OCTA Research Group says the country might experience another surge in COVID infections by next month or in June. Joining us now is OCTA Research Fellow Guido David. Good morning, Professor David. Thank you for joining us this morning. Now, the DOH is continuously monitoring areas with rising cases, and you've also said that cases may spike as early as next month. Why is that so, Professor, and how high do you think the increase will be?
Yes, we're actually closely monitoring certain countries with similar characteristics as the Philippines. And one of them, well, actually two of them are South Africa and India. And why is that? Because they have experienced similar types of surges in the past, such as the Delta surge and an Omicron surge. So the fact that they already had an Omicron surge and now they're having an increase is of course concerning. I mean, other countries like South Korea didn't have the Omicron surge until lately. So it's kind of a different scenario. So in South Africa, they had an increase in cases from about 700 to about 3,000. And this just happened very recently. So we're monitoring that closely. And because it happened in South Africa, just like before, we believe that a similar situation could develop in the Philippines.
Professor, what do you think are the areas na makakaranas ng pinakamalaking increase and why?
Well, we think that the NCR and the major metro areas will still have the increase in cases. Of course, mostly because these are dense populations, and there's a high level of activity going on in these areas. Why is that? Because there will likely be breakthrough infections, just like what we saw in January. So even though NCR was heavily vaccinated, it still saw an increase in cases. We're actually projecting that there will be some waning immunity, and that's why there will be an increase in cases, just like what's happening in South Africa and India.
Well, Professor, there's only 12.9 million of 67.2 million got booster shots. What do you think of this data? Is this surprising to you that it's low?
It is surprising, Mai, and we would want to have more people getting booster shots because the boosters, as shown by the data, will help increase our immunity levels once again. And that will help prevent any possible increase in cases. So if we actually start vaccinating heavily and giving out booster shots, we might be able to limit the surge that might happen sometime in the near future.
And also, we have not been remiss in reminding everyone of the safety protocols, the health protocols like masking up, hand hygiene, and social distancing. Thank you so much for your time this morning, OCTA Research Fellow Guido David.